Start with 345, is that right, Alexis?
That's correct.
Okay, 345.
So SB 345, State Government Information Technology, Review of Projects and Proposals. This is a departmental bill by request from the Department of Information Technology. And the bill will increase the dollar value threshold that triggers the requirement to obtain Board of Public Works approval for information technology proposals involving resource sharing agreements from $100,000 currently to $200,000. It also minimizes review for those projects. The bill also requires state government agencies to advise the Secretary of Information Technology of IT-specific proposals involving the sale or lease of communication sites. Additionally, the bill would remove the need for the proposal to be approved by the Legislative Policy Committee. And finally, where a 30-day period of advertising in the e-Maryland marketplace was required for the proposals under current law, the bill would remove this advertising requirement. There was no opposition at the bill hearing, and there were no amendments submitted. SB 348, State Government Information Technology, Cybersecurity. This is also a departmental bill by request from the Department of Information Technology. The bill codifies a 2019 executive order which established the Office of Security Management within the Department of Information Technology, establishes a position of State Chief Information Security Officer to lead the Office of Security Management, and establishes the Maryland Cybersecurity Coordinating Council. The bill establishes the functions of the aforementioned and creates the membership designations of the council. In addition, legislative and judicial units of state government are required to certify their compliance with security standards on an annual basis. A reporting requirement, finally, is also contained in the bill, through which executive agencies must submit a report to the governor. There is an amendment through the Department of Information Technology contained in your voting packet. The purpose of it is to add a specific position to the Cybersecurity Coordinating Council, and it's to add the Secretary of Disabilities or the Secretary's designee as that member.
Thank you. I just have a question. In the fiscal note, it states that the following agencies are exempt from oversight by DO-IT. And I'm just curious if that's existing law or if that's they're becoming exempt through this bill.
The bill would require those specific entities to be exempt from those requirements.
So are they currently?
I think this is a portion of what the bill would do, but I'm going to take a glance at it one more time.
I'm on the page 2 on analysis. I guess it's under current law. It's current law. Okay. Then that's the answer to my question. Thank you.
Further discussion or debate on 348 as amended. Seeing none, seeing no objection, we're going to vote against the bill. See no hands. We'll vote 348 unanimous as amended. Thank you.
Okay.
All right, Senate Bill 116. This bill requires the Maryland Department of the Environment's Office of Recycling to promote the development of markets for recycled materials and recycled products in the state, as specified. The bill establishes various requirements for the office, including expanded reporting requirements, and requires the office to coordinate its activities with the Department of Commerce, the Department of General Services, the Maryland Department of Transportation, the Maryland Environmental Services, and the Northeast Maryland Waste Disposal Authority, local governments, and private organizations. There is an amendment in your packet on page 2, and it's simply a request from Senator Hester to be added as a co-sponsor.
Okay, is there a motion? Moved by Senator Patterson, seconded by Senator Hester. You know, I've been reminded that the people at home can't hear us unless we put our mic on, and I've been the worst offender. So we have to work to the people following in YouTube, so I apologize. Next bill.
Senate Bill 150, Baltimore County Board of Education Election of Officers. This bill alters the number of votes required for the Baltimore County Board of Education to elect a chair and a vice chair by requiring a majority vote of the voting members currently serving versus a majority vote of a total number of board positions. There are no amendments, and there was no opposition at the hearing.
Is there a motion? Senator Washington moved. Senator Patterson seconded. Discussion on the bill. Senator Simon-Ayer.
Yeah, just clarifying, they have a local letter? Okay.
Yes, they have a local letter.
Further discussion on the bill. It has been endorsed by the Baltimore County delegation. Further discussion. Seeing none, seeing no objection, we will list this bill as unanimous as it goes to the floor. Senate Bill 150 has completed its vote. Next legislation, Senate Bill 200.
Senate Bill 200. This bill prohibits a person from sponsoring, conducting, or participating in a contest organized in Maryland that has the objective of killing a coyote, fox, or raccoon for prizes of monetary rewards. The bill may not be construed to prohibit 1, a landowner or the landowner's agent or lessee from killing coyotes, foxes, or raccoons on the landowner's property, as long as the killing is not part of an organized contest, or 2, lawful dog training or dog performance competitions. The bill establishes a $25 fine for each coyote, fox, or raccoon killed in violation of the bill.
I believe there was no opposition, oral or written. Is there a motion? Senator Washington, is there a second? Senator Lamb, discussion on the bill. Senator Simon-Ayer.
Thank you. I have a couple of fox around me, and I actually like them. I just think that $25 is a very small amount if you're killing these animals. So I would like to make a motion to make it up to 100.
Is there a second for the motion? I'll accept that from the floor. Senator Gallion, is that a second? It's been seconded by the Vice Chairwoman. Discussion on the amendment. Discussion on the amendment. Senator Gallion?
No, not on the amendment.
Okay, on the amendment. Discussion. All those in favor of the amendment signify by raising your hand. I count 3, 5, 6, 10. Okay, the amendment is adopted. Right now, you have the bill as amended in front of you. Senator Gallion.
Yes, I listened to this pretty intently. I noticed this came before the House of Delegates last year, I believe, this similar legislation. And I think it was kind of downplayed, the amount of damage done by coyotes to different farm animals. So I just have some reservations. I know they're saying it's not a good management practice. It doesn't really affect that, but I'm probably going to be in the minority on this one. But I just the more coyotes that are gotten rid of in my book, the better.
Further discussion? Senator Kagan?
Thank you, Mr. Chairman. Senator Gallion, just the bill is clear that it's for contest purposes, so it's not about hunting, overpopulation, or anything. This is about making sport of murdering animals and having contests about it. And so that's why I'm comfortable. But I understand your position. I just think this is different.
And I'd also add, Senator, that DNR can do targeted shoots. I think they have authority to do that as well, I believe. Okay. Further discussion on the bill as amended. Senator Gallion, you'll be voting no. Anybody else want to vote no, or we can do a roll call? I see no other hands. Let us record this as a 10-1 vote. Senator Gallion in the negative. So that is Senate Bill 200 as amended. Goes on to the floor. Next bill.
Memoria. So I just need to clarify, Senate Bill 150 actually doesn't have a local letter yet. So I had it checked in there, and apparently that's not from them. It was from the County Board of Education. So I will go back and check to make sure we got that letter.
Then we will hold Senate
We
Bill
will hold it.
278.
Yep. Yes.
I'm sorry. Senator Lamb?
Yeah, on that bill we just talked about in delegation this morning. We haven't had a chance to vote on it yet, so I don't think there's a letter.
Okay.
there.
We'll
Hopefully
hold
next week.
278 until there's a letter in our possession.
Thank you, Senator
Simoneau.
Simoneau.
Oh. I'm sorry, Senator Lamb, on the coyote? Oh, I thought the council said she had a letter.
I
Okay.
did say it, but in fact, I had a letter from the County Board of Education, not from the actual delegation.
Let me ask this. Do we hold the bill and wait for the letter, or do we pull back our vote?
That's entirely up to you, how you wish to proceed.
When do you think,
Yeah, we just talked about it today. We haven't voted yet
so
today.
you won't meet for another
Probably
week?
another week.
All right, we can withdraw the vote and then
Yeah,
come back up again.
I think we should withdraw the vote, so it's not sitting in our committee for a week. Is there a motion to reverse it and withdraw the vote? Senator Lamb, Senator Patterson, any objection? We're talking about 150, so that's still in front of the committee awaiting a letter from the delegation. Okay, we're on 278.
Senate Bill 278, State Board of Education and Maryland Department of Health, Maryland School-Based Health Center Standards, Telehealth. This bill requires MSDE and MDH to authorize a healthcare practitioner at a school-based health center to provide services through telehealth consistent with the provisions of the Health Occupations article. The bill prohibits MSDE and MDH from, 1, requiring an approved health center to submit an application or to seek approval to provide telehealth services, or 2, to establishing requirements for these health centers to provide telehealth that are inconsistent with specified current law. By July 1, 2021, the agencies must revise the health center standards to reflect the requirements of this bill. This is an emergency bill. There are no amendments, and the opposition was minimal at the hearing.
Is there a motion? Senate Bill 278, Senator Simoneau, followed by Senator Riley.
Yeah, and just to correct, I don't know that we would say the opposition was minimal. I think that's for us to decide. So Okay. First thing, it's really hard to read through all this because we've got so many emails coming in, so I had to read afterwards about some of the opposition or letters of information as well. So I want to go to the high level, and it was stated that 18 of 86 of these centers only had received the telehealth. So if I could ask the sponsor, how many applications have been sent to the Department of Health, because it said this was a problem that they weren't doing that?
Thank you, Senator Simoneau, for the question. As you indicated, there are 86 school-based health centers around the state, and unfortunately, all but 18 are currently closed and not able to provide any services. As we heard at the hearing, 4 of them submitted request to function with the superintendent of education, and they are still waiting for a response. So those students and those families are not getting health care and have not since last March.
Okay, I missed that, so thank you. So only
Sure.
4 applications have not, so we've had 18 approved and 4 have not out of the 86?
So others have not applied. That doesn't mean that they are the only ones that are problematic. There are others that have just been shut down. The reason that this bill is needed is so that we can continue without jumping through additional hoops. The state superintendent indicated that the local superintendents would be able to provide permission, which they cannot. We got testimony from that there is another hoop that folks are being required to jump through in order to provide that kind of health care.
So current law, these hoops you're talking about is what we enacted for the protection of our students. So if you read the letter of information from both departments, the Department of Health says that they provide oversight of these facilities and also protections as far as inspecting the hardware and make sure it's safe for our students. Who is going to be providing that type of protection if you take it away from them?
This would not change inspection. This would not change making sure that the patients are safe. We passed emergency legislation last year to provide telehealth. This just makes sure that everyone has access to the same sort of health care services.
It says in their testimony of the MDH, it says, in effect, MSDE and MDH would have no authority over program standards while still being subject to liability of unanticipated negative program aspects. And they go on to talk about they would be unable to perform these duties designed to ensure quality telehealth services. So obviously the department has concerns. So I guess my main question is, if there's only 4 out of 86 applications that are in the process and haven't been applied or granted yet, although 18 have, why are we changing the whole process instead of trying to remedy a problem? If you think that these 4 are taking too long, why are we changing the processes which has worked over the years?
It hasn't worked over the years, Senator Simoneau. That's why legislation was needed. We passed legislation on an emergency basis last year. As you all know, Governor Hogan signed very few bills last year. Because of COVID, he was so focused, he did not take the time to have bill signing ceremonies or anything. Our telehealth bill was one of the 3 or 4 bills he signed because it was important and because it was needed. Our constituents need access to health care, especially in rural areas, and this is going to make sure that in 86 school-based health centers that the professionals are still going to be able to provide that kind of health care.
And let me just add, just because people didn't apply once it got shut down, it doesn't mean
Right.
they weren't simply waiting for the other 4 to be ruled on. So I think we don't know if the others are just not putting in a formal application or appeal.
Yeah, I think the problem is, though, and I agree with telehealth. I'm behind you on that. We're trying to expand it, and I think that's a good thing. But what you're also doing beside expanding it, you're changing the process where there's oversight by the state, and you're giving it to the locals. And so I haven't heard I've heard a compelling reason for telehealth, and I agree with that. But I haven't heard a compelling reason to change the process because only 4 are still in the process of being approved, and the other ones haven't. So, I mean, what's the compelling reason to change the process, not the telehealth?
So it's not quite accurate, what you just said. It's the 4 that are waiting to be approved are sort of the examples of what the superintendent, the state superintendent, said was the process that would be necessary. It turns out that that's not expediting anything, and we're not getting those students served, those families served. These are people who don't have access to health care if they can't use telehealth. And there will still be the same care, the same inspection, the same oversight in all telehealth that we all believe was a good idea. And so we just need to make sure that everyone has access. These 86 school-based health centers have been providing that sort of care and oversight to families for many years in a lot of these situations. The problem is that since March, they have not been allowed to provide service. And the Department of Health and the Department of Education have not supported the effort to facilitate those. I do have the list of the 86 if anyone's curious to see where they are in their counties or in their districts.
And if I could just ask, of the 4, how long have they been applied for? How long have they been waiting?
I'm sorry, say that again, please.
You said there's 4 applications still outstanding.
4 that have been
How long have
pending?
they been waiting?
So I'm told that there are 20 that have been waiting. 4 have been waiting since November. I think others have applied since then. There's an analogy that I think you heard during the hearing, which is when we get a driver's license, we're allowed to drive anywhere around the state. And we don't need a special driver's license to drive onto school property. This is the same thing. We've allowed telehealth. It should be allowed everywhere, including in our schools, with the same care, protection, inspection, and oversight as anywhere else should be.
Okay, and if I could move on to page 1 in the preamble. Basically says the Maryland General Assembly intends to support access to school-based health care services through telehealth, which is fine, by ensuring that school-based health centers are able to follow the same standards as other health care providers. What standards are different that you're trying to highlight here?
So are you in the fiscal note, Senator?
No, it's on the preamble line 22
okay.
through 24 on the
In the bill.
first page.
Yep.
If you could just highlight the different standards you're referring to.
So that's exactly, I have it highlighted on mine as well. So the whole point is equity, equitable access, the same standards that school-based, that ensuring that school-based health centers are able to follow the same standards as other healthcare providers. So these are the standards that we've enacted last year, and so there just is equal access.
So
through
what
these school-based-
standards have they not been adhering to by other health care centers?
No. So it's not changing the standards. It's just reinforcing that these will be the same standards. So there shouldn't be higher or lower. We should just make sure that telehealth is available.
So, okay, so you're not saying they're different right now?
No, sir.
Okay.
And one of the examples that I may or may not have spoken to, one of the key sources of information about domestic abuse has been in the school-based health centers. You know, a student goes in, tells the nurse, daddy's beating mommy or something, or they see evidence of bruises or malnutrition. Since March, that oversight, that connection to the students is not available. And so telehealth, while imperfect in those situations, the healthcare provider will be able to see over the student's head, see past, to see what sort of place they're living, to see whether there's disrepair, whether there's abuse, what the family situation is like. These kids really need some ability to be checked in on.
Okay, thank you. One other question I had, and I commend you. I do support the telehealth side of it.
Yes.
During the hearing, we talked to Robin Elliott, and she said it was not her intentions to provide abortion services, whether through pills or so forth. And I asked you that question. You said you'd get back with the advocate. So I was wondering if you had an answer to that.
So this is not an abortion bill. This is a telehealth bill. Nothing in this bill will change the services that are being provided.
So your answer is?
This is unrelated to abortion. This is about telehealth and healthcare access during a pandemic.
Okay, because I talked to the Department of Health, and they said pending President Biden, which they're saying they're going to do, is remove that FDA provision that would allow them to go through telehealth and provide abortion pills. So is that your intention, that they would be able to do that, or would you prefer them not to?
It is not my intention, and it is not the reality of this bill. Currently, there is language in our state budget that limits access to reproductive choices. There's nothing in this bill that would change that.
But with all due respect, this bill expands to telehealth, which they don't have currently, and it would open up that door to allow them to provide, as confirmed by the Department of Mental Health. So what I'm hearing is that that is not your intention, that they would be provided with these services. So I would ask that we hold this bill. I'm still working on amendments, and then hopefully I'll have it by the next time.
Okay, the policy is one hold per bill, not per person. So that's a request for a hold. So we will come back to 278 at the next voting session. Let us move on to 304. Senator Riley, you had your hand, okay. 304.
Okay. This bill, 1, repeals a county's authority to use one or more resource recovery facilities that were in operation as of January 1st, 1988, to achieve a 5% reduction in its solid waste stream for the purposes of meeting required solid waste reductions and mandatory recycling rates under the Maryland Recycling Act. 2, excludes incinerator ash from the definition of recyclable materials for purposes of recycling laws. And 3, makes conforming changes, including repealing the definition of a resource recovery facility, again, just in the provisions of law concerning recycling.
Is there a motion? It's been moved favorable. Is there a second? Second. Discussion. Senator Riley.
Currently, Ms. Morton, fly ash is included in some of the local county efforts for recycling?
So the way it works right now is there's a state law sort of saying how much of, it establishes goals for each county to reduce their solid waste stream through recycling.
Right.
Right now, some counties get credit for sending waste to trash incinerators.
Right.
That is considered recycling.
Right. So if this bill passes, then it will be harder for some counties to meet their recycling goals.
Potentially,
Yeah.
yes.
Anne Arundel County has Brandon Shores and some significant fly ash production. That's why I asked. Okay, thank you very much.
Further discussion.
Mr. Chair.
I believe in the fiscal note, Senator Riley, I think it refers to 3 jurisdictions, actually, that are affected by this: Baltimore City, Baltimore County, and Montgomery County.
Right. So I don't believe Anne Arundel County is currently counting that any of that fly ash as recycling.
Okay,
Quick question.
please.
So I remember this hearing. I thought this was about where they had the plastic bags and they were selling them. They thought they were doing recycling and then they actually burned them. That's the main thrust of this bill?
Well, it's not just plastic bags, but yes. In other words, for burning material, they're getting 5% credit on their recycling plan. And we heard one example about plastic bags. So plastic bags, in a significant way, is one of the main things being burnt.
Okay. If I could, I wouldn't mind co-sponsoring if you would be open to that.
Any objection to Senator Simon-Air having his name added as a co-sponsor?
Yeah, can we take that?
Okay, since we've opened that door, anybody else want to be a co-sponsor? Senator Ellis? Okay, so we have Senator Simon-Air and Senator Ellis. With no objection, the bill before you is, the bill is amended. It's a favorable motion. Will anybody be voting no? Seeing none, we will report the amended bill as unanimous as it goes to the floor. That's 304. We go to 344.
Senate Bill 344 is a departmental bill that increases the amount of state funding that projects that are being considered for state cost sharing are eligible to receive under the Maryland Department of Agriculture's Maryland Agricultural Water Quality Cost Share Program, or MAX. This percentage increases from up to 87.5% of eligible cost to up to 100% of eligible cost. The bill does not alter the total available funding for the program or the maximum dollar amount that may be spent on a project. There are two amendments in your packet. The first on page 3 is by request of the Maryland Department of Agriculture. This just moves the bill's effective date to July 1 instead of October 1 to correspond with the start of the fiscal year. And then there's also an amendment on page 4 being offered by Senator Pinsky. This adds a sunset provision terminating the bill after approximately 5 years on June 30th, 2026.
Okay, first let's get the bill on the floor. Is there a motion? It's been moved by Senator Gallion, seconded by Senator Simon Ayer. The bill is open to amendment. Any objection to amendment number 1, which is the agency itself wanted to change the date? Any objection? That amendment is adopted. The second amendment, let me explain. You know, Chesapeake Bay Foundation came up and raised questions about if we allow 100% to be paid for, but it's not the most efficient way to capture the reductions. That's a problem. So I thought one way to address this is to put a sunset where we can evaluate this practice in 5 years to see whether the 100% has worked as was intended. So that's it. I'm not trying to scuttle the bill. Senator Kurza.
And thanks for explaining the amendment. And when you said it's determined, who makes that determination? When you're saying that the Chesapeake Bay Foundation was, I guess, wanted to make sure it was the most cost-effective manner, who actually then makes that determination?
The bill will come back to us in 5 years, and anybody can testify on the bill. The agency can come, any proponents or opponents. I mean, we do.
Okay, so in between, there's nothing that
No, the bill goes into effect.
Okay.
Yeah.
Just to clarify on the sunset, so if the bill sunsets, it'll go back to the 87.5%?
Right.
Okay.
So the agency will come back in 4 years and make a case for why it's been successful. That's all. If they can't, that says something to us as well. That's all.
For what it's worth, we did run this amendment past MDA, and they're fine with it.
Okay. Any objection to the amendment? Seeing none, that has too been adopted. There are two amendments. The bill before you is the bill as amended twice. Discussion. Discussion, seeing none. Will anybody be voting no? If not, we will record it as unanimous as amended. Last bill.
This is Senate Joint Resolution 4. This joint resolution urges the U.S. Congress to amend specified federal law and return federal oversight responsibilities related to the processing and inspection of wild invasive catfish caught in the Chesapeake Bay to the U.S. Food and Drug Administration. The joint resolution states that rules promulgated by the U.S. Department of Agriculture requiring the inspection of blue catfish are unnecessary and burdensome and have led to unintended consequences, which include deflating the market for blue catfish caught in Maryland and financially harming harvesters and the Chesapeake Bay ecosystem.
Is there a motion? Favorable. Second. It's been moved and seconded. Riley. Washington. Discussion. Discussion. Seeing none. If no one will object to this, this too will be recorded as unanimous as it is sent to the floor. Nice work. As I said, it's going to get more difficult as we have more differences and try to figure out language to bills. When subcommittees, and we'll send out a list. Lamore, would you send out the list of people of the subcommittees?
You know what, I will send it out, but just as a note, it is updated on the website.
Okay, it's on the website. As subcommittee meetings are held, we'll announce it to the whole committee. And like I said, the health will get started on some meetings, and I believe education may need some as well, but we'll get back to you on that. Okay.
Do you want to announce?
I don't know what it is.